Since the passage of the Affordable Care Act in 2010, more than 20 million Americans have gained meaningful access to insurance coverage. Before Donald Trump became president, the uninsured in this country fell from 18% to 11%, the biggest jump in any period of time in the country's history. Yet basically, since day one, the Trump administration has actively undermined the law and attacked Americans' health care. The administration cut the advertising and enrollment budget from $100 million to $10 million. This has had a very real consequence, and I have heard stories from my own district where constituents mistakenly believed that the healthcare exchanges ended with the presidency of President Obama. The administration's sabotage efforts have resulted in the highest uninsured rate in 4 years. According to a Kaiser Family Foundation study, over 80% of uninsured adults were not aware of the deadline to enroll in coverage in 2017. Again, it was this Trump administration that reduced the Enrollment Administration's advertising budget from $100 million to $10 million. Another survey by the Commonwealth Fund said that 41% of uninsured adults are still unaware of the ACA marketplaces or that subsidies are available to help them pay for coverage. The Trump administration is strangling health care for millions of people and undermining the law of the land. Ms. Keith, I understand that uninsured Americans are less likely to be aware of the deadlines or availability of affordable coverage. Is that a correct statement of today?
That is correct, yes.
Okay. Also, Ms. Keith, can you briefly describe how gutting funding for outreach and enrollment impacts new enrollments?
Certainly, new enrollees tend to be younger and healthier. As you can imagine, patients who are older and have health conditions are very motivated to enroll in coverage. It's really younger and healthier consumers who aren't aware and need to better understand the marketplace options available to them. What we've seen is since 2016, new enrollment through healthcare.gov is down by about 50%. We need younger and healthier consumers to help keep the risk pools stable and help keep premiums down. I believe I mentioned earlier, Covered California attributes its marketing in 2015 and 2016 to a reduction in 6 to 8% in premiums. So advertising can pay off in terms of sort of bringing in younger and healthier people who need coverage for themselves, but also help the risk pool.
Now, Ms. Keith, can you describe how what you just described, younger, healthier patients not enrolling, how that affects other Americans' ability to get comprehensive health care?
Sure. By not having younger and healthier folks in or having fewer and fewer new enrollees, there's a possibility that premiums will increase.
Okay. Ms. Altman, what's the level of awareness among consumers in Pennsylvania, for example, about the ACA and their health care options in the ACA marketplaces?
I would say that my experience in speaking to Pennsylvanians is very reflective of the study that Ms. Keith mentioned. In particular, there seems to be a significant lack of awareness about the financial support available under the Affordable Care Act. Many consumers come to enrollment events and think there is no way they will be able to afford the coverage, only to find out that it is all more affordable than they ever thought it could be.
Thank you. And also, Ms. Turner, you mentioned something that as a former business owner, on the face of it, I would probably agree with, but I don't agree with in this case about how we're trying to provide comprehensive health care to as many Americans as possible. And I quote, individual patient choice. When I was a little boy, my parents had an individual patient choice, and they chose to go without insurance coverage because it was too far out of reach for my family's single income, first grade education immigrant father who was a gardener. He couldn't be a CEO, didn't aspire to be or what have you, but he provided food on the table for 13 people every single day, and I'm so proud of him and my mother for doing what they could with what little they had. Also, my parents' individual choice was to not participate in preventative medicine practices like going to see a doctor, because even that was too expensive for us to do as a low-income family. My parents' individual patient choice was to look at us and pray for us when we got a bad fever or something, and then now and again, once in a while, say, it's time to go. Time to take us to the emergency room, not to our regular care doctor, not to a place where we could actually be preventative in these measures, but the dangerous choice of waiting to the last minute to decide, I think my child is in very serious danger. Now it's time to go to see a doctor. That is individual choice that the Affordable Care Act, as flawed as it is, has been trying to overcome, and it was able to overcome that for tens of millions of people that before were like my family when I was growing up. Thank you very much, Madam Chair. I yield back.